what is your name, title, and position?
All right, my name is Brian Belcher, and I am the clinical director for the Interprofessional Clinic, which is part of the Institute for Health and Human Services.
What steps did you take to get in this position?
Interviewed and was hired. It's an interesting combination. I used to do public health for years and community outreach, and then I helped start and run a clinic that did medical, dental, and behavioral health services. And so the combination of all those skills probably helped me get this position.
Do you see yourself in this position for a long period of time?
Hopefully so. It's a good job, and it's fairly new. This building obviously is only about a year old, and this program has been around for a while, but not in the way we're doing it now, so there's room for potential and growth, so hopefully I'll be around for a while.
What is your level of education, or what level of education is needed for this position?
I have a bachelor's in a major that doesn't exist here anymore from Appalachian. It was called Health Promotion. It's now Public Health.
Mm-hmm.
And then I have a master's in Public Health from the University of South Carolina. I guess maybe at least a bachelor's degree and then some form of supervisory experience would be required.
What are your goals?
So I want to continue to grow the programming so that we have activities here that serve the community, don't duplicate services, and are beneficial to the students in the College of Health Sciences.
What is your greatest accomplishment in your career as a leader?
With the previous position, I helped write the grant to establish a community health center here. I was one of 4 people to come over and start the program, and then ran the organization as the chief operations officer for about 6 years. So when we started there, it was a piece of paper and 4 people, and when I left, it was 5 offices, 60 employees, and we served about 7,000 patients through 20,000 visits. So that's probably been my best accomplishment, being part of that.
How do you manage your time efficiently?
I use to-do lists, I use my Google Calendar, and I prioritize. So whatever sounds common sense, but whatever's most pressing, work on that first. And if whatever can wait, make it wait.
What past experiences do you feel, or do you bring to your job?
Like I said, I started off as a public health educator in a health department, and I managed an infant mortality program, an employee wellness program. I was on the family violence prevention team, the exercise science community team, and the employee development team. So that taught me how to multitask and be responsible and work with the community. I wrote a lot of grants, and then I came here and worked in the community outreach department of the hospital and got to know the community and how a hospital system worked. And then working at the primary care level and working with people that were uninsured, it helped to do all those things. So all that stuff combines into a great experience of how the world works.
What are the biggest challenges you face?
This position, even though we're a big university, I'm limited in funding. We are a university, so it's bureaucratic, so things don't happen quickly when you want to make change. So that's the biggest challenge, is wanting to do something that doesn't exist yet.
Mm-hmm.
The university's not good at that. It's really good at doing things it's already been doing. It's not as good at doing things that don't exist yet, so figuring that out.
In regards to managing, what are your strengths and weaknesses there?
Strengths are, I bring a collaborative approach because I come from the community, so I like to give people the benefit of the doubt and work collaboratively, not tyrannically. And then if somebody can't do something, try to provide them the resources to do it. The downside of that is if I get somebody that doesn't like doing the job, it can take a little longer to figure that out. Because I don't come with like an autocratic disciplinarian approach. So I guess if you were slack, you're going to be able to be slacker a little longer with me. Yeah. But that's the way I choose to do it because I don't want to, I'm just not interested in like a punishment-based, environment for people to work in.
What are some of your responsibilities as a person in a leadership position?
I directly manage 2 staff that are full-time employees. I manage 5 student employees and 2 interns, and I'm responsible for supporting 4 clinics and also probably 2 different collaboratives in the community that we're trying to develop that don't exist yet.
What do you look for in employees?
Common sense and intelligence. I like working with people who are solution focused, not problem focused. Because y'all, I'm sure, have worked at places. And you think about it, would you rather work with somebody that comes in and complains every day about how much they hate their job, or somebody that when a problem comes across your desk that they jump in and figure out how to fix it? Who's more pleasant to be around? So yes, that's the type of people that I want to work with, is the ones that if they come to me with a problem, they immediately have an idea on how to fix it. They don't want to spend an hour complaining how terrible it is.
Right. How important are interpersonal relationships with employees to you?
Very important. I mean, there's a balance. I think you can't just only want to select being a parent almost, although that's a weird analogy. But I mean, obviously, it's good to have good congenial relationships. But I try to just work with people. I mean, I want people to be okay with me and me okay with them. If you hate each other, you're not going to work together. They also can't be fearful of you because a lot of studies show that they'll only do enough to not get in trouble.
Mm-hmm.
So it's important that they have respect for what I know and what I want them to do, I guess. And so as long as we could do that and it be a decent, fun environment, then we should be okay.
What are some strategies they use to improve the performance of your employees?
Make it goal-based. Ask them specifically for what I'd like them to do, and then I do my best to make sure they have the resources to do it.
How do you encourage staff motivation and productivity?
Probably the same. I also, we work collaboratively. I share goals that we need to do as an organization, but then we collectively brainstorm on how to get there. And if somebody comes to me and says, well, I don't like the way this works, then I say, well, let's talk about how to do it differently so that you will like it.
How do you manage new versus experienced staff?
With new people, it's very important. I think we tend to like to sit people down, do a really intensive training, and then say good luck and get frustrated if they don't do it right. And a lot of studies show it takes a good 6 months to a year to onboard somebody. So it's really important to circle back periodically and ask people how they're doing. Do they understand this? And if you see something wrong, immediately address it and say, hey, you don't say, you're in trouble. You say, all right, this isn't how we want this to go. Can you do it this way next time, kind of thing.
How do you handle conflict in the workplace?
Conflict sucks. There's no way around that. I just try to address it openly with if I see an employee do something wrong, I don't go in there to say you're in trouble. I go in there to say, hey, this didn't work right. Tell me why it didn't, and tell me what we need to do differently. And now if I saw that, turns out the $20 is missing because they stole it and bought beer that night, we have a problem. But if it's that, well, the way we add up the money is too complicated, I don't understand it, then we can address that.
How have you improved since taking this position?
How have I improved? I have learned, I've always been pretty patient, but I've learned extra patience here just to learn to navigate the bureaucracy. From the other place, since I was in charge, if I wanted to do something, I did it. Nothing crazy, but if I wanted the clinic to flow a different way, I'd started it the next day. And here, there are way more processes involved. Even though I manage the clinic, I don't supervise the people that provide the care. We have 4 different departments, and so we have to collaborate. So I've learned to slow down a little bit and be a bit more patient when we want to make changes.
And would you choose this career path again?
Yes.